National trends show that doctors tend to practice close to where they're trained. That's why Munson Medical Center in Traverse City created the Family Practice Residency Program. The program is important because in the next decade, new specialists will be needed to take the place of Munson staff that is currently 55 years and older. In this week's Your Health Matters, I worked with photojournalist Bob Rhodes to introduce you to one resident physician who's not only from Northern Michigan, but he plans to stay here. For Jake Flynn of Benzie County, the choice was simple when it came to deciding where he would end up doing his residency.
It wasn't until I came back as a med student and rotated through Munson that I got here, and it just kind of like clicked, and it was kind of a perfect fit.
After college and medical school, Flynn rotated through several different hospitals across the country. He wanted to see what other areas had to offer. He ultimately made the decision to come back home and is now a part of Munson's Family Practice Residency Program.
All of a sudden I realized that it's like these are my people, and I was so comfortable up here. As I would rotate through these different cities, I would get a lot of people saying, "You must be from the Midwest. Like, what part of the Midwest are you from?" And I would say, you know, how could you possibly guess that? You know, someone on the subway in New York would say this, and they would be like, "Well, you're polite, or you're kind, or something like that." And you're like, "Wow, that's an interesting observation for someone, you know, not from this area." And they relate that kind of personality, and I think nobody expresses it more than Northern Michiganders.
The program was designed to meet the primary care physicians needed in Northern Michigan. To break it down, 30% of Munson's current medical staff is 55 years and older, and in the next decade, new specialists will be needed to take their place.
The mission of our residency is to train family practice physicians for practice in rural Northern Michigan. And our success rate with that is about 60% of our graduates fit our mission.
Dr. J. William Rollin is the director of the Family Practice Residency Program and says residents who are from the region, much like Jake Flynn, are exactly what the hospital is looking for.
Most graduates either they came here because it's a good place to train, but their true roots and connections are somewhere else in the country. But there is certainly that little X factor of if your physician was, you know, born and raised in Northern Michigan, they trained in Northern Michigan, and they stay in Northern Michigan, they probably really do kind of get what the way of life is here.
You meet a patient, and they sit down and you start talking, and they say, you know, I'm coming from Kingsley or Buckley, or I'm here from Torch Lake or something like that, and you can recognize these things, and you can say, okay, well, you know, oh, okay, I know what physical therapy you're at in Kingsley because I'm familiar with it. And it establishes a nice rapport quickly with these patients.
And for Flynn, the choice is still very simple when it comes to deciding what he'll do after his residency.
This is the place where everyone vacations, so it's a pretty easy sell to try to get us to want to live up here. I think it's kind of one of those things, if you can live up here and make a good living, you do. It's a great place to live, and who wouldn't want to live up here?
He's got a good point. The Munson Family Practice Residency Program also partners with Michigan State University College of Human Medicine and Osteopathic Medicine. Dr. Rollins says he hopes a recent Munson expansion, allowing more physicians into the program, will also help increase applicants over the years.